let's talk about everything in the latest from the health news. Dr. Isaac Bogoch, an infectious diseases specialist from Toronto General Hospital, joins us almost every Tuesday morning at this time. Nice to see you again, Doctor. I hope you had a good long weekend. Let's get into measles again. You know, we have this conversation kind of week in, week out lately, but you know, what really more can be said about the current outbreak? The cases keep rising. Age eligibility for the vaccine, that's now even earlier in Ontario. That's kind of new, but this is happening mostly in unvaccinated people. Is there something that could bend the curve, slow the spread here?
Right. The only way that this outbreak is going to stop is when the virus meets a wall of immunity. And the wall of immunity comes from one of two things. Number one, immunity from vaccination, or number two, sadly, immunity from people becoming infected and then creating immunity themselves. Obviously, it's far preferable for this virus to meet a wall of immunity related to vaccination. You know, there's significant ongoing efforts to ensure that those who remain unvaccinated, especially kids, to receive the vaccination through, as you point out, some changing policy in Ontario where even kids living in areas where the virus outbreak is strongest, they can receive the first dose of the measles vaccine at an earlier age, at 6 months instead of 1 year, to prevent them from getting this infection. But I think, as we chatted about it a few weeks earlier, it's tough. It's hard work to really build trust, answer questions, address people's questions in an empathetic, fact-based, data-driven manner, such that when they're presented with the choice for vaccination, they say, yeah, this is a good idea. We don't want to have this infection rip through our family or our community.
Yeah. So, I mean, can we ask how long this could last, or is this kind of like how long is a piece of string?
Yeah, it will come to an end. But, a lot of that is determined by the degree of vaccine uptake. And, sadly, this can continue for many more months. I don't think it would come to anyone's surprise if this continues on into and perhaps even through the summer at the rate it's going now. Obviously, unfortunate. Nobody wants to see this happen. But, when we take a step back and look at the 30,000-foot view, there are unvaccinated or under-vaccinated pockets and communities within Canada. There's unprecedented human mobility, and we know that people move around and they could bring this infection with them. If you go, for example, on the Ontario Public Health website, you can see out an entire list of places where there's been a possible measles exposure. So you can imagine if there's a non-immune person who's in that area at that time, there's a high risk that person can get infected. And, we talked about this during COVID. It's human mobility, communicable infections, the spread of infections, and like, the vaccine is extraordinarily effective at blocking transmission. Is it 100% perfect 100% of the time? No, of course, nothing is. But it's very, very effective in preventing infection and stopping transmission. And that's really what we need to do.
I remember the graph we showed a few months ago showing the impact. Okay, so when you talk about that, Dr. Bogoch, as the infectious diseases expert, when you consider what's happening with measles, are there potentially other infectious diseases that, perhaps were considered eradicated that could make a comeback in the current climate?
Oh, 100%. Measles is the canary in the coal mine. It's usually the first to rear its ugly head, and it's visible. As you can see, it's got this classic rash. But whenever you start to see measles outbreaks, and I'm not just talking about Canada, I'm talking about globally, you have to look for other cracks in public health and other infections that can rear their ugly heads, but albeit slower. So you start with thinking about vaccine preventable illnesses. And, even here in Canada, we had whooping cough, also known as pertussis outbreaks, not that long ago. So other vaccine preventable illnesses, but you also have to look at other infections and programs, and especially infections that are kept in place by strong public health programs, tuberculosis control, HIV control. And now thinking globally for a second, you've seen sadly, the defunding of mega public health projects at a global level, including HIV and tuberculosis control programs. And it would come to no one's surprise if we see the tremendous progress being made on those fronts start to sadly reverse themselves but it will take time. But if there's no funding for these programs, that's probably what we're going to see, unfortunately.
Boy, what a sad reality check that is. Okay, that is Dr. Isaac Bogoch. Appreciate the time as always, Dr. Bogoch. We'll see you in a week's time. Thanks.
My pleasure. Have a great day.